Welcome to the series of educational videos about Germanische Heilkunde by Dr. Med. Gerd Hummer. My name is Helmut Pilhar. I am the father of Olivia, and the lecturer on Germanische Heilkunde theory, appointed by Dr. Hummer. Germanische Heilkunde by Dr. Hummer explains not only how our body works. It also explains why we think, act and feel the way we do. The combination of two sensible biological special programs results in a biological supersense. This topic points in the direction of character explanation. The various constellations, asthma, stuttering, hearing voices, bulimia, lesbian, anorexia, washing compulsion, are explained by case studies. The aim is to understand why people are the way they are, and what we can do about it. Learn more about this in the approximately 1.5 hour educational video. Ladies and gentlemen, I welcome you to our educational video on Germanische Heilkunde by Dr. Med. Gerd Hummer. Today's topic, the constellations in the territorial area, Part 2. We stand virtually behind the patient and look at his brain from above. And the red area, which is the cerebral cortex, the orange is the cerebral medulla, and we are talking about the so-called territorial area. We have the male territorial area on the right, the female territorial area on the left. That's the same for both males and females, which is also related to hormones. The different squiggles are supposed to be the brain relays, and you start in the territorial area as follows. The woman, whether she's left-handed or right-handed, she's a woman and has female sensation. And the man, whether he's left-handed or right-handed, he has male sensation and behavior. The man will act offensively, the masculine principle, and the woman will act the feminine principle, defensively. You can also see this clearly in road traffic. The man has his outer territory and he is going on the hunt. The woman has her inner territory, her nest, she raises the children. And the first conflict in the woman must be a female one. So we are only talking about the territorial conflicts, where the hormonal status has a considerable role. The handedness has a considerable role, but not partner or mother-child. So we are at the following special programs. We are at hypoglycemia. We are at hyperglycemia, type 1 diabetes. We are at bronchial musculature. We are at laryngeal musculature, laryngeal mucosa, bronchial mucosa. We are at coronary vessels, coronary arteries, coronary veins. This relay also controls the uterine cervix and portio, the PAP. We are at the hepatic bile ducts, gastric ulcer, duodenal ulcer, pancreatitis, hemorrhoids, the visible and the urinary tract. Renal pelvis, ureter, bladder, tube, left relay for right organ side, and right relay for left organ side. The first conflict in the woman must be a female one, and there is no other way. Unless she is in menopause, unless she takes the birth control pill or she is pregnant. But we exclude that for now. So the first conflict also in the girl must be a female one. The girl has her menarche at 11, becomes mature. But the girl was also female before, and is also female after. At age 11 would generally be the first menstrual bleeding. The boy's voice changes at 14. But he was male before and is male afterward. In terms of sensation, we now have the female fear-disgust conflict, which is the spider, for example. The female scare fright. The female sexual conflict, the identity conflict, not knowing which opinion to follow, and not being able to demarcate one's inner territory, when someone approaches the woman too closely, so to speak. And masculine feeling, the masculine resistance conflict, territorial fear, loss of territory, territorial anger. So, territorial fear, how is this supposed to go on? The rival is about to break into my territory. Territory loss, the rival comes and kicks me out of the territory. Territory trouble, the rival is standing in my territory. And the boundary dispute with the neighbor chief. Where is the fence to be drawn? The male territory marking conflict. The next thing to remember, this map is correct for the right-handed. So if a woman has a female sexual conflict, it affects her cardiac venous relay. If the right-handed man has a male territorial conflict, it affects him in the cardiac arteries. For the left-handers, it occurs the so-called night hop. When the left-handed woman has a female sexual conflict, She is struck right vis-a-vis in the male territorial area, but it is felt female. The left-handed woman has an entirely different special program going on, and she has the coronary arteries active. And just as analogous, the left-handed male. When he has a loss of territory, he has what's called the night hop. It hits right vis-a-vis in the female territory area, but it's felt male. The next thing that you have to remember beforehand is the first conflict in the territorial area, that closes that territorial area. Respectively, it has taken away the sensing. If the right-handed woman has a sexual conflict in the cardiac vein relay, her complete female side is closed. The female sensation is taken away from her. She also stops having periods. If this happens to the girl, she does not get her menarche at 11, and she is now conflictively male. So the female feeling is now gone, and she is changed in nature, tomboyish. She is the right-handed man. But if she then suffers the second conflict, this can be felt only male, that is a male conflict, and it strikes then accordingly vis-a-vis in the male territory. In the same way the man, if he has a loss of territory. For the right-handed man, it strikes in the cardiac coronary arteries, and it closes his right male brain side. The left female side remains free, and with the one conflict he is soft. He is changed in his nature, he is feminine. The boy then begins to play with dolls. And if he suffers a second conflict as a right-handed boy, he can only feel it as female. This strikes then accordingly vis-a-vis in the female territory. From then on is a constellation, so the Hummer focus is right and left in the brain. Then we speak of a schizophrenic constellation. The schizophrenic territorial constellation has several peculiarities at once. It stops the emotional maturity. So if the boy, let's say 10, comes into the constellation, that is, he suffers his second conflict, then emotionally he remains the 10-year-old. Provided the constellation remains. Even if he is 50, he is then quasi still the 10-year-old boy. If a person reacts emotionally, we can recognize his maturity. Likewise, the woman, if the woman is, say, stuck at 12 but is already 40 years old, she still feels like the 12-year-old from back then, and she also acts accordingly. Also, from the figure, she looks like the 12-year-old, and also from the face. So it stops the maturity, but it also stops the massive conflict. We are apparently healthy, and a scale is created. Now it is weighed. Which conflict weighs more, the left or the right? When the left conflict weighs more, the left feminine side is more blocked, then the right masculine side remains more open. The scales, let's say, fall to the left. In that case, one is manic and male. The manic woman is a masculine woman. The manic man is a masculine man. And manic means happy, dynamic, and a good mood. The fully manic ones, they run naked through the streets, they want to convert the world, they feel like God. But if the right conflict has more weight, then the right masculine side is more blocked, and then the left feminine side is more open. Then the scale falls to the right, then you are feminine and depressed. The depressed man is a feminine man, the depressed woman is a feminine woman. And depressed means quiet, still, withdrawn. The fully depressed, they lock themselves away. Close the curtains, turn off the light. And they suffer silently. The depressives you don't see, and you don't hear, and the manic ones annoy you all day long. And it can stay like that. One is only manic, or one is only depressive. Or via the tracks, the scale swings back and forth, then you're manic depressive. So we are in the constellation, one is psychologically conspicuous but apparently healthy. So, that was a slight repetition of the most important things, and we ended in part 1 with the mythomania. I would like to discuss the autistic person briefly. And the combination of two sensible, biological, special programs also gives a biological supersense. Where we say he is crazy, this also has a biological supersense. And that also points in the direction of the character. One says, he is just like that. But why is he, for example, a mythomaniac? Or why is he depressed, or why is he gay? With a man, all it takes is a loss of territory, and he's gay. Why is he like that? Because he has the conflict. And if the stomach relay and the larynx are active, if the active Homer focus is present, then we can unravel this. With a right-handed woman, the one conflict would be a scare fright, perceived feminine. She becomes male with this. And the second conflict would be the territorial anger. With a right-handed person, the territorial anger would be the first conflict. He becomes female. And when he suffers a scare-fright conflict, it affects him in the larynx as well. And in the left-handed, it is with night hop. I don't want it to be too complicated. The left-handed person, of course, first has male territorial fear, night hop in the larynx. This closes the left female side to him. He remains male. And the left-handed person reacts with the second male conflict and suffers territorial anger, and thus, he is also in the autistic constellation. In the autistic one we can see, I think, most beautifully, the difference between intellectual and emotional maturity. It stops the emotional maturity, but not the intellectual maturity. It is possible to graduate from university with maturity of 12 years. These are then the intellectual professors who are actually children, and there they are telling about something important. But if he reacts emotionally, you're looking at a 12-year-old. And they are even doing it more easily. A 12-year-old has absolutely no ambition to start a family. The big boy in Hotel Mama. He has plenty of time to memorize phone book pages, and he's a 12-year-old. Even if he's 30, if he's 40, he's actually still the 12-year-old from back then. Whereas the alphas got full emotional maturity and didn't have conflicts in the territory, that distinguishes the alpha. 1 out of 100 is alpha. There are also alpha women, that is of course a full-blooded woman. She has round shoulders, doesn't have male territorial behavior, doesn't have period pain, and she is a wise woman. And the alpha, that's usually a representation of a man, a real man's image, and he's not moody either. Such an alpha, you look for him, you love him, you appreciate him, and you seek his advice, a wise man. However, only 1 in 100 is alpha today. And the autists, they live in their own cheese bell and do not take part in the life right and left. Just the other way round to the mythomaniac, he has the Hummer focus in the bronchial relay and the rectum. With him, the constellation is exactly mirror inverted. The mythomaniac doesn't let you speak, and the autist, you don't get a word out of him. It is precisely the wrong way around. And autistic people are very, very pedantic. They don't tolerate changes, they don't like the spoon to be out of place, or the shoes to be out of place. And autistic people are known for their intellectual acrobatics. They can shift nth root algorithm of 125 in their head or have a photographic memory, but they are not able to lead an independent life. If they have a guiding hand that leads them through life, then they are just lucky. So, here we are at the stomach and the larynx. And, of course, there is always the emphasis. The manic autistic are pretty creative. They can spend half a year working on an inlay, such a small picture, 20 by 20 centimeters. Everybody else throws away their nerves, but autistic people can do that. And the depressives in the constellation are generally listless. So now, no matter what constellation, the depressives, as I said, they close themselves off. You don't see or hear them. You can always resolve only the last conflict first. So always, only the second and then the first, or the first remains cemented as long as the second is on top of it. But let's say, that how can I help such a person when it comes to that? I must always proceed causally and respect such a constellation also has specific stability over the tracks. A conflict is only resolved when it can no longer happen, or when I can laugh about it. But as long as the second conflict could still happen, the tracks are working, and the second conflict holds the first, and to crack such a constellation is not easy. Also, it often requires of the surrounding, that the surrounding community plays along. If you only encounter a lack of understanding, you have no chance with the patient, you can't get him out of there. And such a patent solution, however, would be a dog for the child. For the constellated woman a baby, and for the constellated man, a territory. The clue is, in all three cases a new life begins for the patient. For the child, the whole world now revolves around his dog, he tells the dog everything. The child can pour out his heart, everything he would not tell his parents, and he can solve the constellation. For the woman, the whole world now revolves around her baby, around her child, around the new family. And she can throw off the constellation. The same for the man with his new territory. And the same for the student and Muchel. Mind student Machen can transform these cortices, these cerebral cortical conflicts, so that the scale calms down. When there is no more pressure on the conflicts, the scale is horizontal, and we are inconspicuous. We are conspicuous when the scale swings or rocks back and forth, manic depressive, then we are conspicuous. But if there is no pressure on the scale, left and right, the scale is horizontal, we are inconspicuous, and slight conflicts can be resolved more quickly than more severe conflicts. So the student HN works wonders with children. Children also really like the Santa Claus voice of Hamer, and it is easier to convince a child why you play it quietly at night, than to a pubescent or a 20-year-old. He will ask you if you are crazy. And let's say it stops maturity, and the earlier the child gets out of the constellation, the sooner he can catch up with maturity. Until 25. At 25 you no longer catch up with maturity. I can solve the constellation, but you can catch up with maturity only until age 25. So, now a few examples for the autistic. A husband once invited me for a lecture. I picked up the couple from home and they had a guest, a 26-year-old computer hacker. So he was introduced to me. He wanted to get into the car with me and he was reprimanded by the host. His shirt was stained, and he should please go and change. I have noticed this before in an embarrassing way. He was a guest there and has to be reprimanded, so to speak. And at the lecture, he only played with his computer. He let the lecture be a lecture. I talked to him on the way home. He is in early retirement, he never went to work. He is autistic and laryngeal asthmatic and he is right-handed, and the whole dilemma started at 4, the setting into kindergarten. That means laryngeal asthma. When the laryngeal relay gets into crisis, you have pseudo-croup. And if vis-a-vis somewhere, there is a Hummer focus, then I have laryngeal asthma for the time of the crisis. So he must have impacted the left relay, which he may release occasionally. The crisis is in and of itself a reason for joy. I was able to resolve a conflict. The problem is only the track. Via the tracks the conflict comes again. And if he is autistic, then the right conflict must be in the stomach relay. And for the autistic, the dearest counterpart is of course, often the computer. They can really fall into it. I also do write software, so you forget the world left and right. And there are software companies that only hire autistic people. The next morning, I watch him as he smears a self-brought pudding on the plate, he gets his hands dirty and he wipes himself. And after half an hour I was ready to say goodbye. I shook hands with everyone and had the pudding in my fingers. And that's the autist. Intellectually he beats you by miles. I don't need to tell you what he can do in terms of software. But emotionally he is the little boy. You have to take him by the hand and say, now let's go change our shirts, now let's go wash our hands. That is the autist. The wife of this man told me the story of her husband. She was with him at Hummer and he is autistic, he is right-handed and the first conflict was, they took away his playpen. And his second conflict, with age 5 the parents has stabbed his beloved piggy, and immediately the autist was perfect. This example shows the following clearly. The autistic person is in the foreground. I may still tell their story. His wife is a physicist, and together with her husband they write highly scientific articles for such alternative scientific newspapers. Highly complex scientific. And she says, she can't send her husband for sandwiches because he speaks to the children at the bus stop, because he himself got stuck when he was 5 years old. He is from the emotional maturity still the 5-year-old, but he is an intellectual acrobat. He took notes during my lecture, but not words. He wrote formulas. He wrote my entire lecture in mathematical formulas. Amazing. And what you might see well is, what do the playpen and the stabbed piggy have in common with the autistic? Attention. There are hundreds of territorial anger and hundreds of scare-fright conflicts. Hundreds. The one with the playpen and the piggy, that's just one example, and of course, always with the 3 criteria, highly acute, in isolation and caught on the wrong foot. Otherwise there would be no Hummer focus. But what does the one have to do with the other? Hummer says that the previous psychiatry or psychology was on the wrong track. They always saw in front of them the autistic, or the patient with washing compulsion, or the choleric, who just got upset again because the little boy slammed the door. They have discussed the problem, and in reality you only need to solve the conflict with the beloved piggy and the autistic person is gone. You have to start somewhere else. The previous psychiatry and psychology did not understand this at all. It was also not to be understood, as long as the Germanische Heilkunde was not discovered. So he only needs to solve one of the two conflicts, but only the last conflict goes first. So when the last conflict is solved, that is the second conflict first, the autism is gone. An example from the literature. The first conflict of this left-handed woman happened when she was 12. She had a boyfriend since the age of 6, to whom she had attached herself. From one day to the next, he suddenly didn't want to meet her anymore. She suffered an identity conflict with night hop and gastric ulcer. Since then she was depressed. At first for 6 years, later, after another 4 years break, depressed again for 10 years. The left-handed girl is depressive with the first conflict. The right-handed girl is manic with the first conflict, and the right-handed girl is always only in the constellation manic-depressive. But the left-handed girl is depressive with the first conflict. Shortly after the first DHS, she argued with her mother. The mother screamed so loudly that it went even through her bones. She suffered a scare-fright conflict during this. So the left-handed female. Her male right side is closet, the left side remains free, she remains female. She becomes over-feminine by the depression. And if it happens a second conflict, it must strike vis-a-vis, but is also felt that way. So she is depressed with the one conflict, female. If it happens a second conflict, it is felt as female and strikes vis-a-vis. If this is a scare-fright conflict, it's in the larynx. So the left-handed woman reacts 2 times female. And since then she was and remained in an autistic constellation, with short interruptions. Not always continuously but very often. She then broods for hours, has no drive, is depressed and as if spellbound. So as I said, the depressed are without drive. Since then, when her relationship has failed and she hears her mother's shrill voice, even if only on the phone, she is instantly in the autistic constellation. She then sits for hours brooding obsessively, unable to stop the brooding. That points into the character. He's got his quirks. But why does he have his quirks? And as I said, that's where mind student Mei Chen would help. Now we come to the announced topic. Let's discuss the basic principles of musculature. Bronchial musculature, laryngeal musculature, that is the striated musculature. So is the skeletal musculature. There's still the smooth intestinal musculature, but we're at the transversely striated musculature. When I'm hunting, I'm sympathicatonic. When I have a conflict, I am also sympathicatonic but paralyzed. That's the MS in the transversely striated musculature, in the skeletal musculature. And when I resolve that motor conflict I have the epileptic seizure, the epileptic. I am also sympathicatonic. So we have 3 times sympathicatonia but of different quality. Depending on whether I don't have a special program. I have a special program active, or I'm in crisis. And the epileptic seizure and bronchial musculature, laryngeal musculature, it's also called tonic-clonic. Tonic, prolonged spasm, when the conflict has lasted a long time. And clonic, rhythmic, if it was short. And if now the bronchial musculature is paralyzed, if this hummer focus is active, that is not noticeable. We breathe via the diaphragm. But if this bronchial musculature comes into crisis, then I have spastic bronchitis. And if for the time of crisis, vis-a-vis somewhere a conflict is active, I have a constellation for the time of crisis. So, the crisis is active like a hummer focus. And bronchial asthma seizure. The asthma seizure is a crisis in a constellation. And vice versa, the laryngeal musculature. If that spasms, I have the pseudo-croup, without mucosa. But if I have vis-a-vis a second hummer focus somewhere active, I also have constellation and laryngeal asthma for the crisis. They don't get the air in. The bronchi don't get the air out and larynx, they also don't get the air in. It's also called laryngeal asthma. And if both of them come into crisis at the same time, I can't get the air out, and I can't get it in. That's the status, and that's dangerous. That's when you can also suffocate. And also, here you can explain the following nicely. Cortisone has a sympathicatonic effect. Cortisone, when do you give the asthmatic? He gets cortisone. And cortisone, the asthmatic, he is just in crisis. And cortisone has a very strong sympathicatonic effect. Shouldn't the crisis become stronger if the patient takes the asthma spray, the cortisone spray? Hummer says that cortisone does not have a purely sympathicotonic effect, like coffee for example. Coffee has a purely sympathicotonic effect. But cortisone works more like a conflict relapse. If I am conflict active, then I have paralysis. When the asthmatic takes his cortisone spray, it paralyzes his muscles, which is why there is relaxation. But then he has to get back into healing first. So better than cortisone, of course, would be to keep the conflict definitely resolved. But of course, before he suffocates you give cortisone. But there you can explain nicely the effect of cortisone on this example. A case of trachs. The trach is basically the allergy. And I may as well be allergic to the mother-in-law, with colon cancer. And in the active phase I have constipation, and in the healing I have diarrhea. The trach is the mother-in-law, because I suffer the trouble with her. And in the moment of shock, when the Hummer focus hits the brain, my brain has linked the mother-in-law to the conflict. And the trach is just an early warning system. From now on, whenever I see the mother-in-law, watch out, mother-in-law, boom, and my gut overreacts to solve the problem. So we have to learn to understand medicine biologically. What did nature intend with the gut, with these special programs? This is the indigestible trouble. And the indigestible morsel to be able to defrost the morsel. That's why I react with the intestine, the trouble with the mother-in-law. Also, a case from the literature. A patient suffered from occasional asthma seizures since childhood. She was eventually diagnosed with a cat dander allergy, which was thought to be the cause of her seizures. Despite this, the patient continued to be attracted to cats, which she would occasionally pet. Strikingly, she rarely suffered an asthma seizure while doing so. On the other hand, she did have seizures when she had not been in contact with a cat at all. When she then went on a conflict search, she was surprised to discover that she only reacted to black cats of a specific size. Or if by chance she had once seen a dead animal on the street. Eventually in her further research, she found out that she had witnessed her beloved black kitten as a toddler, as she was very attached to it, being run over and crushed by a car in the street. That was the conflict, highly acute, in isolation and caught on the wrong foot. She consciously had no memory at all of the event itself, which was now more than 20 years ago. Nevertheless, she reacted each time with a relapse. Meaning that it starts all over again when she saw or stroked a black cat that was a particular size. Or if she saw a dead animal lying in the road, that had been run over. The trachs, that's some diabolical stuff. A seminar participant tells me that he was with me a year before at the introductory lecture. And he has had asthma since childhood. He is allergic to everything that has anything in common with horses. To oats, to horse dumplings on the path. He only needs to see a horse standing in the meadow a mile away, and he has problems with the air. And a year ago, at an introductory lecture, he became aware of his conflict. Namely, at the age of 7, together with his grandfather, he led a horse by the halter to the pasture. And the horse stands up on its hind legs, pulls the boy into the air, the boy whirls in the air, the boy falls with his back on the ground and above his face the hooves from the horse. Mind presently, the grandfather pushes the horse aside, so nothing worse has happened. But that was his shock, and from now on he was allergic to a horse. And now there are these extension tracks. So whenever the Hummer focus arrives, another track can save itself along with it. Anyway, when he came to his grandfather's farm as a boy, there is of course a dung heap. And that's an extraordinary smell. You don't smell it every day. And now his brain deals with the smell. Then the horse runs across the yard and he has the recurrence via the horse. The Hummer focus comes and stores the horse manure as an extension track. Now he reacts asthmatically to the horse and horse manure. Then his grandfather sends him to feed the horse with a bucket of oats. He pours the oats in, the oats are dusting and the dust is on his nose. The brain is now dealing with oats. Do I need to do anything? Do I need to make antibodies or what? He goes to the horse with the oats and because of the horse, the Hummer focus enters, a recurrence, and now it saves oats as an extension track. Now he is allergic to horse manure and oats. A year ago, when he found the conflict he thought, what will the oats do to me, if I go that way from the field? Nothing. What do the horse dumplings do to me, along the field path? Nothing. What does the horse in the meadow a mile away do to me? Nothing. I don't go there and it doesn't go here. What does it do to me? Nothing at all. And he was able to dissolve those extension tracks because of that. And he has his quality of life, 90% fewer problems with the air, and that's just by getting to the conflict. And when the horse is right in front of him, that's when he has problems. The horse is powerful and it can kick or severely injure him, even when he's 60. And he can't get it out of his head. But he doesn't have to. If I know my weak point, I don't have to go directly to the horse. I don't have to go directly to the boss. I can also avoid the track. But I have to know once why I have that. The linchpin in Germanische Heilkunde is the conflict, the event at that time with 7. You have to find that. That is also only an example. There are 100,000 asthmatics, but just the one with a horse. Maybe there are 100 others with horses, also asthmatic, but the principle is always the same. If he has laryngeal asthma, then he must have suffered such a scare fright, or in the case of the left-hander, such a territorial fear. It's the same for everybody. But there are hundreds of types of startle scare fright, and hundreds of types of territorial fear conflicts. And you have to find that out first. And then of course, it is a vast difference, whether the conflict can still happen or whether it can no longer happen. Let's assume that the event was not the horse but the grandfather, who gave him the conflict. And the grandfather has died in the meantime, and he is no longer the little boy from back then. He is now 60 himself. What happened back then is now irrelevant. Because the grandpa is lying at the cemetery, already for 40 years. And he is not the little boy anymore. Then the tracks dissolve, but ultimately. And then he would be rid of his asthma. But in that case the conflict is not resolvable because the horse can actually hurt him to this day. And in that case he has to avoid the horse, to stay healthy. And he can't avoid the horse. If he were a quasi-horse owner, where he has to be in the horse stable every day, he would have chronic asthma. Unchanged. But if he lives somewhere in the city, is an employee, then he has nothing to do with horses, then he's rid of his asthma. So that's a huge difference. Can it happen again from that time, or not anymore? A 40-year-old tells me in the year 2000, he has very severe neurodermatitis. But it looked terrible. There were no 10 square centimeters without some bloody red spot. And very severe asthma, often status. And he was dozens of times on recovery, he got hundreds of injections, and nothing helped. And he is married, he has 2 children, and you always have to look where it started. It started with him when he was 4 months old. Asthma and neurodermitis. So the boy must have suffered a separation conflict at age 4 months, the skin, outer skin, neurodermatitis and status asthmaticus. So he must have suffered territorial fear and scare fright at 4 months of age. The art of the therapist is to be able to put himself in the other person's shoes. The therapist needs a certain empathy. Do you manage to put yourself in a 4-month-old boy's shoes? Empathize. He must have suffered a separation conflict, highly acute, in isolation and caught on the wrong foot. A scare fright and a territorial fear. What could it be? We said, if you deal with the Germanic, we can interpret the organs correctly. And now, you put yourself in such a 4-month-old toddler? My first question was, where was the mother? The mother protects her child. Every mother strives to raise an alpha. Every mother. Even the animal mother, even the human mother protects her child from conflict. Where was the mother? He says, it all started with a 1-week stay in the clinic. Since then he has had neurodermatitis and asthma, since he was 4 months old. I say, I dare to bet that the mother wasn't there. He says he doesn't know. His mother has already died, he can't ask her anymore. But he will ask the father, and then he comes back all upset from the father and says, that's right, I was alone in the clinic for a week. How do I know that? Because I know the Germanic, you can put that together. It has nothing to do with prophecy. You need common sense. You have to be able to put yourself in the other person's shoes. That was in 2000 and I met him again in 2005. He tells me in a side sentence that he no longer has neurodermatitis. He no longer has asthma. There the tracks have dissolved because what happened at that time can no longer happen today. He is no longer the 4-month-old boy who has to stay in the clinic, abandoned by his mother. That can't happen anymore. He's 40, he's married, he has children of his own, he's been living without the mother for a long time. What happened then cannot happen again today. And everything dissolves into thin air. These hundreds of injections have all helped nothing. These spot treatments have not helped at all. Once you find your way to the conflict, you realize that it is meaningless, and everything disappears into thin air. This therapy costs nothing, has no side effects, and is the medicine of freedom. The system in which we live has something against it. They cannot earn anything from it. Now imagine once, the Germanische Heilkunde would become well known in the population. What do all the conventional doctors and pharmaceutical billionaires do? What do? They have a huge problem. So, this is a good track case. You can learn something from every testimonial. And now I can illustrate something beautiful to you. She has had asthma, seizures, and middle ear infections every 6 months, since she was 4 years old. The combination is interesting, it must have a reason. According to conventional medicine, the recurring bronchitis is to blame, and the damp apartment is to blame for that. The real trigger. The parents drank alcohol with pleasure and regularly, and also got regularly into their hair. The children were not supposed to know anything about it and lay on the first floor in the children's room. But the patient got long ears and followed the quarrel of the parents. And the middle ear infection is the cure of the information morsel. Once the quarrel between the parents escalates, the mother escapes to the children's room and blocks the door. The original sound of the patient, she now describes the conflict. I hear the father rumbling up the old wooden stairs. Loudly, he knocks and hammers and rattles our room door. I stare at the old iron door lock all the time. I could still picture it today. In the moment of shock when the Hummer focus hits, the brain goes snap like a camera. I remember everything that is somehow relevant. He mother-in-law, the anger of the horse, the accident. I can still remember that I was insanely afraid that he would somehow manage to get in, and that although I was never afraid of my father. On the contrary, my father was always very loving to me until his death, and he would never have raised his hand against me. But the whole situation was very scary for me as a 4-year-old. And now an example, do not psychologize, learn to think biologically. The father would never have raised his hand against her, but nevertheless, because of the father she suffered this conflict, and the track is the father. And she is now chronically ill, on the track father with recurrences. In the years that followed, the patient had countless hospitalizations for her asthma, as a child. The first turning point in her medical history came with her first boyfriend. She began to detach herself from her family of origin, and the attacks became fewer, the panacea. Biological conflicts need a biological solution, and a biological solution for the woman is her own family. A new life begins. The previous conflicts from the parental home become irrelevant. That is the patent solution, have children. Yes, quickly. Tonight, strive. Nevertheless, she had asthma seizures on and off, until 38. When her father died, a last violent attack followed, and since then she has been rid of her asthma. So the track was the father, although he would never have raised his hand against her. And why? Because it became a biological conflict. We have to learn to think biologically. You'll never get anywhere with conventional psychology. Biology works a little differently. The track is nothing other than an early warning system. Back then she was terrified of her father. And now she is allergic to her father. And that will be resolved when he dies. It's also quite typical that when it's resolved, there's another intense healing phase, an intense crisis, and then it's good. At a lecture, a mother comes and tells me that her 4-year-old son has asthma. Where does that come from? He does not go to kindergarten, she does not work, and he is at home with her. And what can be the scare fright, the territorial fear in a 4-year-old boy? There is often the typical marital quarrel. We divorce, separation, and so on. I ask, where's daddy? She says, we recently separated. I say, well, that's where we already have the problem. She says, yes, the boy is very attached to his father. But he's had asthma for a year now, and they've just separated recently. I say, you don't just decide to break up from one day to the next, there's usually a corresponding history. And the boy will have noticed this marital quarrel. She says, that may be so. Yes, but what should I do now? I say, well, you know the cause now, you have to give your child his daddy back. Says she, no, that's out of the question. Says I, you're the boss. No one else can help there except you and your husband together. If you are an intact family again, then the boy will get well. If not, he'll stay chronically ill until he has a family of his own unless extension tracks are added again. And that is also an example, they would know where to start, but the environment does not play along. And then they are lost. Then it is quickly said, the Germanische Heilkunde is not correct. On the contrary, it is true. The Germanic says that if the environment does not change, the boy will remain chronically ill. That is the problem with knowledge suppression. This knowledge belongs to biology classes. If the parents have a quarrel, suddenly the child reacts asthmatically, then the parents know why. Then they think about it maybe 3 times, whether this is not nonsense what they do there. Because what is the result? A sick child, that is their flesh and blood, that is their future. They destroy their future because of such a nonsensical marriage quarrel. But this knowledge is consistently suppressed. This is also a beautiful case of a young woman as a child, and she came with her mother. She has asthma and neurodermatitis since birth. And that is both a healing phase symptom. That means she must have suffered a separation conflict and a scare fright, territorial fear conflict in the womb, depending on male or female. And the mother immediately knew the conflict. Namely, when she was pregnant. This pregnancy was entirely inconvenient for her. She was in the abortion clinic, had the door buckle already in her hand, and at the last second she changed her mind. The patient witnessed this as an unborn child. It is fascinating how that works. But the unborn child can think along with the mother, it can feel with the mother. How this works, we can only observe that it is like this. Anyway, the 2 of them had a good cry. And she was 25 and married, and had no children. And often it is so, that a young person precisely for a reason is still arrested in the parental home, about the tracks. And, if she has a child, she can cut the cord. I say to her, you are now 25, married and have no children. What are you waiting for? For you to turn 35 or what? At home, she says to her husband, Pilar thinks we should have children. Says he, you know, I've been thinking about that too. Then they made an effort, and half a year later she came to the seminar, 3 months pregnant. Neurodermatitis has gone, asthma is gone. And as I said, nature would have put the therapy in our way anyway. In nature, we would have a biological society and this woman would already have 3 or 4 children. And she would have been rid of her neurodermatitis and asthma, long ago. And many women say, oh, I had neurodermatitis in childhood, but with the first child of my own, it was gone. And that is precisely the mechanism. It takes a lot of effort to get out of the way of nature. You have to become a bank employee, and you have to be brainwashed once, and all that induced lunacy. Induced lunacy. We are told that this society would be the best for us. In our society, if she has her first child at the age of 30, this woman would be asthmatic and neurodermatitis until 30. And that is just this civilization junk, as Hummer calls it. We have to get a form of society again, which corresponds to us and our kind. This way, we will have fewer conflicts, and we will automatically be healthier and happier. I don't really need all this junk. Now the stuttering is similar to laryngeal asthma. We have here the Broca's Center, and if that gets into the epicrisis and I have a Hummer focus somewhere vis-a-vis, then he stutters. And depending on the duration of the conflict, he stutters kkkkkc, can't get the letters out. Or if the conflict was only short, he talks so fast that you can't understand him at all. But that's this relay, the Broca's Center, the speech center, and in crisis. A grandmother tells me that her 4-year-old grandson mumbles so terribly that he has to consult a speech therapist twice a week. I say to her, the boy must have suffered a scare fright or a territorial fear, depending on handedness as first or second conflict, and there are no more possibilities. Either female or male felt. She says, yes, that's what Hummer says too. I say, yes, of course. I know this from Hummer. I don't know it from anyone else. But if he continues to mumble, then there must be a track. Nothing comes from nothing. If something is, then something is. If there is nothing, then there is nothing. It's as simple as that. And she does know her grandchild. What she suspects as a grandmother, she says, she suspects the daughter-in-law. She locks the boy away for an hour at lunchtime, because she wants to have her peace. With the key turned. And because the boy was already quite mobile, he was climbing on the windowsill. But, so that people from the street would not see him standing in the window, up on the second floor, she closes the blind beforehand, and she does that every day. I say, why does the mother do that? Says the grandma, if I could talk to the mother. The grandparents with their 2 sons and their 2 families lived together in one house, and there I knew my way around, although I am not a therapist. Here comes the daughter-in-law, and I saw the cause at first sight. She herself is very developmentally retarded, a baby face. She may have been stuck like that at age 4 or 5. And a 4 or 5-year-old has emotionally no problem at all locking her 4-year-old away for an hour once. Anyway, we decided that she can have her hour of peace, but she doesn't have to turn the key. The boy can run to the uncle or the grandparents. This is all in one house. Supposedly it has gotten better. I no longer have any contact with this family. But beware, there are no alternatives to natural laws. You can send the boy to the speech therapist 5 times a week. As long as the problem is not fixed, you are only causing the boy more stress and more conflict. And vice versa, if you solve the cause, then you don't need a speech therapist. Then everything will dissolve into nothing. That is the medicine of freedom. Let's say it's like learning to cooking. The beginning is a bit difficult, but then soon, the first successes appear, and at some point, the soup tastes good. And that's how it is here. If this were, let's say, general education, knowing this, we could help so much or help ourselves. We don't need anyone to do that. In the rarest cases we would need once an emergency medicine or a therapist. Only I can heal myself, nobody was there during my conflict, only I myself can reveal it. Nobody can live my life, I have to do it myself, and nobody can heal me, only I can do it myself. There is no cure for asthma, there is no such thing. There is no alternative to natural laws. But conversely, this also makes me free. I keep my dignity as a human being and am not degraded as a patient who is treated. I have to act myself, and I must learn to understand this and act to become an adult. This doctor stutters, but so terribly. It always takes me half a day to understand him, to get into his speech rhythm. He says he had a traffic accident with a skull base fracture when he was 20, and he was in a coma for several weeks. And he remembers nothing about the accident, nothing at all. The brain has wholly blocked that out. But since the accident, he stutters. But so terribly. The conflict was only brief, and the talks de wizardels. And it is very, very difficult to understand him. But he drives his car. I mean, that is of course the track. Such an accident can happen again at any time. If I were him, I would try not to drive for half a year to see what happens. Because stuttering is, as I said, a crisis. And every time I get into healing, I reduce conflict mass. There is little conflict mass behind it. That's what you're supposed to solve. So, now it gets a bit complicated. When I'm crossing the street, and I'm not paying attention, suddenly tires squeal. It comes as a shock to me, highly acute, in isolation and caught on the wrong foot. I think I don't hear correctly, and I suffer a hearing conflict. So, the squealing of the tires can be memorized as a track. Then I have tinnitus, which is the frequency from the squealing of the tires. Now, in the future when I go to the street, I have a recurrence and I hear the squealing of the tires to warn me. The track, the allergy, that's the early warning system. And when I get off the track, when I get into the healing, then I have hearing loss. The frequency fades out. I hear the frequencies above it and the frequencies below it, but not that frequency. At the end of the healing, it's fine again. And now it depends on how often I get on the track. Permanently, then I have tinnitus. And if I'm in a hanging cure, if I'm only occasionally active, in out, then I'm hard of hearing. But the spoken sentence can also become a hearing conflict. If someone says to me, "Helmut, your sister is a prostitute." And I, "Please, what?" I don't hear right, prostitute? And the other person says, yeah, and she takes drugs. And I'm like, and drugs. Then I have two hearing conflicts now, and when they are territory related, I hear voices. I only hear voices in territorial hearing conflicts. Once you hear it, that would get a little complicated again, and then I hear voices. Yes, your sister is a prostitute and does drugs. Yes, the sister is a prostitute and does drugs, then I hear the voice. A naturopath heard about Hummer, and her husband and her father died in short order. And they all lived in one house. And especially in the basement, she heard the husband and the father in her head, how to store the fruits and vegetables. And then she was on the phone with Dr. Hummer, now they just gave me instructions again. It took her 2 years to sell the house and move away. Then, she got out of the constellation. That's when the house was just the track. She knew why she hears voices and also knew, somehow she will get out of it. Because of this knowledge she did not panic. So let's say, if I have no idea about the Germanische Heilkunde and I suddenly hear voices, then I turn the wheel. But she remained calm and knew somehow, something must be there. And then she found it, it must be something with the house, and she moved away, she sold the house and then it was good. So, can you help yourself with a highly efficient remedy against hearing voices? There is none. But you can even help others, help your child get well, or help your partner get well. You can even help your mother-in-law to get well, if you want to. If you don't want to, then you don't. And this woman heard the mother and the dear Lord. Namely, the first conflict at age 7 years, she heard the mother moaning during sex. We have the sexual relay in the right-handed woman, which controls the cervix, uterine and the coronary veins. In brain that's right above it. And below that is the auditory relay. So she had suffered a double conflict, sexual and auditory relay. And the grandmother always read the Bible, and that annoyed the mother. Half a year later the mother said, the grandma belongs with her head on the chopping block. Then the child suffered a second hearing conflict. And now the child heard the mother and God. If now this woman hears God and the mother, if she still has a mythomaniac constellation, the mythomaniacs are the writers, the poetry writers. Then they channel. They hear the voices and write them down. From these people, the channels, I would like to have once a brain CT. I myself was once in a constellation, in a hearing constellation. And I think I know what the conflicts were. Namely, I heard the telephone, although it did not ring. It was set to such a tune, and I heard the complete tune, that I nudged my wife in bed and said, do you hear that too? That was just in my head. And the two conflicts to that must have been territorial related hearing conflicts. Therefore, one conflict I suspect. I like to lie down in bed for an hour after lunch, such a midday nap. Now I'm also at the age where that is very restful. And regularly the telephone tore me out of my short sleep. That must have been the first conflict. A hearing conflict, I think I don't hear right, the stupid phone, and then it's over with the sleep. Also, the second hearing conflict with the phone. I was sitting here in the video room, which is on the second floor, and I hear the phone ringing downstairs, that's the ground floor. And nobody cares about the stupid phone. So I dash out into the stairwell and make a scream that my son came out of the room next door and looked what's going on now. My wife could not hear the phone, she was in the basement with the laundry machine, and it was of course impossible that she would have heard it. But that must have been my second hearing conflict. And when I found it, I switched the phone to another melody or the regular ringing. Because so I know when I hear the melody, that is only in my head because now the phone rings. And with that, the constellation was gone again. Danger recognized, danger averted. If you know the name Boogeyman, then the terror is gone. Now it gets a bit mystical. A medium has a spirit being. And the story of this spirit, who was a rogue in the Middle Ages, and to make up for it, it helps people in need. And now the clients come to this medium with their life problems. The medium doesn't go into a trance much at all, just asks the spirit, and he gives advice. And she passes the advice on to her clients, and she is incredibly famous. People come from all over the world. And someone comes to the medium with the golden books, still shrink-wrapped initially in plastic, and asks if this is something sensible or if this is nonsense. And the medium asks the spirit, and the spirit says, "That's awesome." Asks the medium, "What's that all about?" Because the spirit has never said that. With homeopathy and kinesiology and everything, the spirit had something to say. And when he said, "That's awesome," the spirit had never said that before. And now the medium herself began to be interested in Germanische Heilkunde. She invited me to lectures, she organized seminars for me, and then she flew to Hummer with her own brain CT. She told Hummer nothing about her gift. And Hummer sees in the brain CT her hearing constellation and asks her, "Do you hear voices?" But the exciting thing was with the medium, it swears the complete environment, the family, the circle of friends, they all swear on this spirit. There they lost one or the other and could not find it. The medium asks the spirit, which says, "In the closet, top left, at the very back." And there it was. And now the question is, how does it work? How does she find this lost object? How does that work? Once I stumbled from the frying pan into the fire. And that was at the very beginning, which must have been in 1995. The Olivia story was still in the media. That's when I ran into Dr. Lim. This is the Feng Shui master. He made Feng Shui popular in Europe. And Dr. Lim did not miss the opportunity to examine Olivia's sleeping place. And suddenly, Dr. Lim stood with his employees and with me together in the kitchen. I had built a wooden bed for my children, a double bed at 1.50 meters and a third across above with a slide down. Olivia was lying on the bottom, and for Lim it was clear, the wooden beam that goes right over Olivia's belly was the cause of Olivia's cancer. So he threw out the bed. Then he hung glass balls in front of the window and crossed flutes over the front door, and he charged me the equivalent of $900. I was packed to the brim. After all, I hadn't asked him for anything. And then this Dr. Lim ran with his route through the bedroom of the parents-in-law and said, "This one is sleeping higher, he has problems with his head, and the one sleeping next to him has problems with his neck, there is a water vein going through." I was stunned. Grandma was operated on the head, Grandpa on the thyroid gland. I was stunned. We called Hummer and asked if he had forgotten something in the new medicine. For example, water lines. Then I stumbled from the frying pan into the fire when Hummer said, "This has nothing to do with water lines, but that Lim does it telepathically. He doesn't have to be aware of it. He plugs in, gets the information, and translates everything with a water line in the route. Like the woman with the spirit also does it telepathically, and she wraps the whole thing with the spirit so that the other one can accept it. But they do it telepathically." And on the tooth chart, Hummer has also drawn the telepathic window. Some also say the third eye. So, that is on the forehead, about the hairline. So with me, it is a good bit further down. And Hummer says that everybody can do that more or less. There are gifted ones, and we can do it even with the animal. So, let's say my Rottweiler bitch, when we are at lunch, she sits down next to me and looks me in the eye. And I know exactly what she wants. In the meantime, I can accept the telepathy half and half. So, we also know about these relays. These are brain relays without organ reference, and there you can also suffer a conflict. If you are hypnotized against your will, or if you want to hypnotize and cannot, then you have a Hummer focus without organ reference. And let's say, send and receive. I am an electrician, so I can roughly imagine how it works, and with telepathy you can also explain a lot. And we have another man in Vienna who is said to have X-ray vision. The doctors send patients to him. He looks at the patient and says, he has problems with the pancreas. And the therapist says that this is also possible when the patient is in the room next to him. He does not have to see him. It works telepathically. The voice hearing with this woman was the quarrel of the parents because of the deer money. They got chronically into each other's hair about it, and still do today. That is her story, 2 hearing conflicts. Of course, one can say, what do the hearing conflicts and the quarreling parents have in common with the spirit? That is again just the content, but we have to look at the pot. If she could resolve the conflicts, then she would be rid of her gift. I mean, sometimes it's not so desirable. She makes her living doing that. Now the bulimia, the binge eating. The hypoglycemia makes the cravings, and the gastric relay makes the vomiting. And there we are with a small curvature of the stomach, and we are with the alpha islet cells. And if there's a Hummer focus there, I have a loss of function. There's no sugar being produced, and I'm hypoglycemic. That's rarely diagnosed, Because if you eat something the blood sugar fits again and you feel well again, but you have to eat. And they can be fat, they always have their chocolate with them. Now, an excellent case where you will understand the bulimia. Hummer was in prison from 1997 to 1998 for violation of the naturopathic law. I mean, the discoverer of Germanische Heilkunde is jailed, because he has no license to practice medicine, and he has discussed patient cases with doctors. The judge has reinterpreted that into treatment and he is not allowed to treat, so off to jail. And a fellow inmate, a prisoner, was bulimic. His first conflict was at the age of 5. His father was a musician and liked to drink. He took the boy with him to the pub. Drunk, he stuffed canned fish and cucumber salad into the boy's mouth. In the process the boy suffered territorial anger and threw up. And the father stuffs the vomit into him again. And that's when he suffered a fear-disgust conflict. Now, whenever he smelled the cucumber salad or canned fish, he had to throw up, but he had to eat at the same time because he was hypoglycemic. This is the bulimic. Attention, these are not the people who put their fingers in their mouths. This is the anorexic. I will explain that in a moment. Something even more interesting happened to the boy. Namely, whenever he saw a uniformed man, he did his next burglary. That's why he was in prison. He had continually robbed the same brand of the gas station from a chain of gas stations. He knew exactly where he could get in on the roof and where he could turn off the alarm system. And that always worked, 200 burglaries. He was so successful that he got a companion, and he ratted him out. That's why he was in jail. Hummer wrote a chapter at that time, The Spontaneous Crimes. So, it was enough with him to see a uniformed man. He reminded him of his father and he did the next burglary, the next day. That is the spontaneous crime, a separate chapter in the Golden Book. So, let's leave bulimia alone now. Let's do the lesbian woman. She has the postmortem constellation and a sexually colored hypoglycemic conflict. It has to be sexually colored, so fear disgust. A girl falls head over heels into the pond and has mud in her mouth, suffers a fear disgust conflict. But it is not sexually colored. But oral sex, fear disgust conflict, that is sexually colored. If she is postmortem about it, she is lesbian as a result. This is also the case with gays. You can see at a glance who is the man and who is the woman. You can see at a glance how they lie in bed. So there is, of course, also with the lesbian couples, always the male and the female lesbian. The manic one, that's the male one. The depressive, that's the female lesbian. This 40-year-old woman, at age 9 years old she ran from the garden to the laundry room, the door was not locked. And she catches dad and mom having sex on the laundry machine. She sees everything, especially dad's willy. And she suffered a sexual conflict and a female fear-disgust conflict at the same time. If these are felt at the same time, they can strike in the same territory. If there is a difference in time, the second conflict must strike vis-a-vis. But several conflicts can strike at the same time. With that she was Electra. With these territories, the tracks are then the fixation. With her it was mainly the dad's willy, and therefore she was Electra. At 13, she was groped by a young boy, and that brought her period. Today, she lives with her dad and her lesbian girlfriend, and they also like to go to the mixed sauna. As long as the men's dicks hang down it's not an issue. But when it straightens up, it's pa. Because that was their conflict, men are gross. And, I understand the lesbians too. I do also think men are gross. I always advise an organ diary. So make an effort. If you have symptoms, photograph them, document them, write them down. A year later, you don't even know, did this start in October or in November? Also for the child or the grandchild. Keep an organ diary like that. There is little point in keeping a diary about the psyche. And here is a nice example. The 30-year-old daughter is a lesbian and the mother calls Hummer. Hummer has the brain CT and says, the first conflict must have been at 10, and the second at 11. And if she can still remember it. So, the mother asks her daughter, an incident at 10. The first conflict at 10, there was also a fear disgust. And indeed, the first conflict was at 10. The daughter still knew exactly the conflict at 10. She was sitting with the father in the living room watching TV. The mother was on the phone with her friend's mother. The phone call was quite emotional and loud, and the daughter knew it was about her. Namely, she was playing doctor with her friend. And her mother said, she got vaginal mycosis from playing doctor. This mother was convinced of this, and accusingly she told her mother about it on the phone, and the 10-year-old girl noticed all this in the living room. After the phone call, the mother went into the living room and said, "And you get out of here right now, go to your room." At that she felt so dirty. She felt like she had abused the friend. And she kept a diary. She wrote down every fart, but not this event. That was so awful to her that she didn't write it down at all. And so you tend to stick to the organ level. The organ level can't lie. If you have a symptom, then something must have happened. If nothing happened, you don't have a symptom. And with the psyche we delude ourselves a lot. We think that it was horrible, that it is just a psychological problem. And we don't write down what hit us. The psyche is very deceptive. The organ level cannot lie. Almost lesbian. She is the daughter of a prostitute. The life partner of the mother had child porn magazines lying around and always undressed her, the patient, with his eyes. At that time she always had bulimia. At 17, she formally fled from her parents with her first boyfriend. Now she came out of bulimia. And the mother had always kept her short with food. In freedom she gained 40 kilograms in half a year. Now she was only hypoglycemic and no longer had to throw up. That's Alzheimer's bulimia, you forget to throw up. No. That was fun. And she is 25, almost back to an average figure, and has 3 children by 2 men. She sends Hummer her brain CT. And Hummer sees she is in the lesbian constellation, and he asks her if she is a lesbian. She says, "Hummer, I have 3 children by 2 men. But after the phone call she thought about it, that's what she told me. She had a friend with whom she almost went to bed once. She liked to see her get naked. They almost once ended up in bed with each other. Even on the street when she meets a pretty woman, she looks after her. Like a man who looks after a woman. She has often thought about whether she might be a lesbian. Many men are gay, but would never dare to live it out, which are then married to a male woman, but they are gay. This patient had her brain CT with Hummer, and Dr. Hummer said to her, "You actually might be a lesbian," and she assured me that she was not. She was in a happy relationship with her boyfriend. But then this man must be a softie, because she was manic and male. I wonder if her husband might be a good cook. And indeed, her husband has round female shoulders and cooks hobby-like. Now, very briefly still to this case. Consider the following. Hummer has the brain CT of her. And he describes from her brain CT her life partner. How he must be, is that out of the ordinary? That's weird, but it works. It works. If you know a gay man who is manic, then you know his partner is the woman, because there is no other way. It doesn't work any other way. In private, she then told me that she had actually once gotten involved with a woman, and she also looks after pretty women on the street. So she lied to Hummer completely. Well, that also exists. I know a couple of lesbians who separated after 15 years, a very bad story. I felt sorry for both of them, so they suffered like dogs. Then, I was again in their neighborhood on a lecture, and the one had meanwhile another life partner. They came in threes, so to speak. And the ex sat away remotely, and the other with her new life partner celebrated right in front of me. They nibbled a bar of chocolate together. And the ex had to watch. And the lesbians are hypoglycemic, they like to snack. So if you know, these are the subtleties. That's observation, that's all it is. I just observed it. Then, anorexia. Now, that's the gastric relay in some constellation, and manic. So they have to be manic in any case. And they have the obsessive idea that they're too fat. That's why now they stick their finger down their throat, to vomit it up again. I have one case, anorexia. A 27-year-old right-handed woman, and she is really disfigured by her anorexia. Present in the interview was her boyfriend. She had her brain CT with Hummer, and Hummer commented that she should just eat a little bit of food at a time. She says, that can't be the solution. She always had period pain, and for the last 6 months she hasn't had period pain at all. So, when period pains are present, there is always this sexual relay in a constellation. If she had only this one conflict, she would not have a period at all. So she must be in the constellation. And the more the conflict is emphasized, the more the period pain is. And if it is emphasized full, then the period can also be absent, because they are full male. And, as I said, the anorexics, they're fully manic. And her boyfriend had the conversation with Hummer, and Hummer had said that it was also the periosteum of the pubic bone that was affected in her. And the periosteum is the brutal separation. So, a brutal separation at the pubic bone, what do you run with that? I asked her if she had been abused. She says she has not been abused. I ask, really not? Well, I didn't believe her. A brutal separation on the pubic bone, what else could it be? I had to leave for a moment, and when I came back her boyfriend said, yes, she was abused. Hummer had already told him at that time that his girlfriend must have been abused. So her friend knew, but didn't tell her that he knew. And now she heard it again from me. He told her in my absence that Hummer also claimed that, and now she has admitted it. She was very young at that time. Now that has less to do with anorexia, but that was probably her sexual conflict. And at age 14 she got her period. That must have been the territorial anger. I don't know what it was exactly. I don't know. But now, back to anorexia. She has no organ symptoms, she can eat. She just has to use a trick. She thinks she doesn't want to get fat. And she's just skin and bones and ugly. So it's not organic, it's just psychological. That's why Hummer said just eat, force yourself, eat. Don't be stupid. If it gets worse, she'll have to be force-fed, whether she wants to or not. And I'd rather eat little bites like that. So, then the washing compulsion. Now, this is something complicated again. In the front of the cranial fossa, frontally, we have the smelling conflict, and here we are with the loss of function. This has nothing to do with the nasal mucosa, sneezing and sniffles, but it is the loss of the sense of smell. The smelling conflict may have happened in childhood and does not matter. But, when at the age of 12 the constellation of the territorial area comes, then the person has washing compulsion. So, there must be any territorial constellation, connected with the smelling conflict, that happened 10 years before, and suddenly you have the washing compulsion. And she stopped developing at 13. She has the figure and the behavior of a pubescent. She has no children and could not catch up with maturity. And she rescues problem animals. From Romania she saves the animals from being killed. Her first sexual conflict at 5, she heard her parents having sex and thus she became Electra. Her husband is older by 12 years, that is Electra. So, a sexual conflict with the dad. The smelling conflict was at age 5. The parents raised 2 young piglets every year, slaughtered them and processed them. From the window the 5-year-old watched this event. The whole house smelled afterward of blood and washed intestines. I know this. I grew up on a farm with a friend of mine. I know that smell. At 13, she got her period and her washing compulsion. So the right-handed girl with the one sexual conflict doesn't have a period. She needs a second one so she can get her period at all. And at 13 she got her period, so there came the constellation and the washing compulsion. The smelling conflict was with 5, the blood. She can smell it when other women have their periods, and also when they have recently had sexual intercourse. She has a very keen sense of smell, and she also has a pronounced obsession with cleaning. The house has to be vacuumed once a day for an hour. Often several times a day. So she is just vacuuming, and several times a day, she has to take a shower to wash off the smell of her period. She is worried that others might smell it. That's the washing compulsion. And she also has the Flyers constellation. At 17 she jumped, surprisingly for herself, from the balcony, several meters into the depth. Because her husband expelled her from the house. So the Flyer, post-mortem manic, that's the bridge jumpers. And the Flyer, that's the esoteric. In her house, angel figures are hanging all over the place, and of saints, everywhere. It's so along the lines of character. You say, she's like that. But why is she like that? So, and now one more mind-blowing case, and then we'll end. At the end of a lecture, we were sitting with a glass of beer. And there was a couple of about 50 years old, and the wife complained about her husband's compulsive washing. He doesn't touch doorknobs. He elbows them open, and when the door opens inward, he waits patiently until someone comes in, and then he slips out. And when she comes home from out of town, she can't touch him. She has to wash her hands right away. And, at some point he protested and said, "I can't know what doorknobs you've touched. Some people come from the toilet without washing their hands." And so I say to him, "Yes, you must have suffered a smelling conflict once?" Suddenly he sat up straight in the chair and shouted, "The ether!" We were all startled. He says, "I still have the stench in my nose today." Namely, at age 7 he was anesthetized with ether for an appendectomy. And a conflict is only resolved when that can't happen again. And I said to him, "But that can't happen anymore, they don't use ether today." And I guess today he doesn't have a washing compulsion anymore, when he realizes that the conflict dissolves. And I haven't met him anymore, unfortunately. But, I would be very interested to know whether he still has the washing compulsion today. But that only resolves when it can no longer happen. The horse can hit me at any time, so this conflict is not irrelevant. I still have to avoid the horse track, then I am healthy. But the ether is no longer used today. So, ladies and gentlemen, I'm through with the lesson. Our next educational video will deal with the constellations, outside the territory. There are the visual constellations, the fear in the neck, the paranoia, medullary and cerebellar constellations, and exciting are also the brainstem constellations, the coma patient, and the disorientation. Thank you for your participation, for your interest, and I would be glad to welcome you again. Until then, I wish you a pleasant time. Helmut Pilhar.